Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. And a big thank you to my patrons on Patreon for your contributions to my channel. If you spent any time studying electrical stimulation as a therapeutic modality, you've probably seen a figure that looks something like this. This is what's called a strength duration curve, and on first glance it can seem really imposing and overwhelming. But we're going to break down how you interpret this throughout the course of this video. Let's start by breaking down the axes of this figure. So on the horizontal axis down here, this is the pulse duration, which by the way is the same thing as the pulse width. And it's measured in time units. Most applications, so for most modalities, it will be units of microseconds, but there are occasions where you might even get into the milliseconds. And remember, a millisecond is much larger than a microsecond. So down here we have 100 microseconds pulse duration. Here's 300 microseconds. Over here though, this would be 1 millisecond. And over here this would be 100 milliseconds, which is actually a tenth of a second. Okay, so hopefully that makes sense. Over here on the vertical axis we have current strength, which is the same thing as intensity. And the units for current strength or intensity are milliamperes or milliamps. Okay. Now with some of these parameters like pulse duration, frequency, ramp time, these are specific numbers that I'm going to have to program in the machine. Okay, so for pulse duration, maybe I want to use 150 microseconds, so it's a specific number. With frequency, maybe it's 80 hertz, or same thing as 80 pulses per second. If I'm doing ramp time, maybe it's 2 seconds. Okay, but with intensity on most machines, this is not a specific number of milliamps. So when you program intensity on a machine, you should already have your pulse duration, your frequency, any other specific parameter already set, and then you're just cranking up the intensity, 1, 2, 3, 4, 5, 6, and so on, up until either you have the desired effect or the patient doesn't want it to go any higher. Okay? And so sometimes you may get up to an intensity of 10 on your machine. So two things. Number one, that doesn't mean 10 milliamps. That's just an arbitrary intensity setting on the machine. And number two, that 10 of intensity on that particular machine, if you go to another company's machine or just a different machine in general, that intensity of 10 will not be the same as the intensity on the machine you were using. Okay, so intensity on most machines is not the number of milliamps, it's just an arbitrary number. And so that's how we're going to treat it on this graph. And so when we interpret this figure, we just pick an arbitrary intensity. We're not worried about how many milliamps this is because this is all conceptual right here. We generally want to pick an intensity, as in this horizontal line right here, that intersects all 5 of these curves on the graph. In theory, we could bring this line and do it way down here, but I want to pick an arbitrary intensity right up here where it intersects all 5 of those curves. And then that brings us to the 5 curves. What are they? Well, these each correspond to either a particular type of tissue or a particular type of nerve. So this red one on the far left is A beta sensory. This is typically the type of nerve that we're trying to stimulate with the conventional setting on TENS and IFC. The purple curve right here is for motor neurons or motor nerves. These are not the muscles themselves, these are the motor neurons that innervate a particular skeletal muscle. Okay? And the green curve right here are the A delta nerve fibers, which are responsible for transmitting information regarding sharp pain. Both of these, the motor neurons and the A delta sharp pain fibers, these are going to be stimulated when we use the acupuncture setting on TENS and IFC, and also electrical muscle stimulation, so NMES and Russian stimulation. Now way over here at higher pulse durations, here we have C nerve fibers. These are responsible for transmitting information regarding dull pain. There aren't many applications that you would normally use where you'd want to stimulate these. And then the blue curve right here is for denervated muscle, basically skeletal muscle that no longer has functional neurons that innervate it. You'll notice that to get the muscle that has no neurons that innervate it, you have to use a much higher pulse duration than you would just to stimulate the motor neuron that leads to a skeletal muscle. So basically what I do is I take this vertical line right here that goes from the horizontal axis up to this intensity line, and I just move it to the right or to the left. Now as I move it to the right like this, at this point right there, I now am at a pulse duration of 100 microseconds given this arbitrary intensity. Okay? I can keep moving it to the right, and I'm now at a pulse duration of 150 microseconds. And I can do this all day. I can move this around. I could even go way up here and get up to a pulse duration of 1 millisecond, right? So I can move this to the right, I can move it to the left, and depending on where it hits the x-axis, okay, that's the pulse duration that I'm at. Now, why is that useful? Well, let's actually go up to a pulse duration of about 80 microseconds. So right there, that's a pulse duration of about 80 microseconds. Now, at this pulse duration, does this vertical line cross the green curve? No, of course not. Does it cross the purple curve? Of course not. But does this vertical line cross the red curve? Yes. So at a pulse duration of about 80 microseconds, at this intensity, that is going to stimulate the A beta sensory fibers, the fibers that correspond to this red curve. And if we think about A beta sensory fibers, those are what we're trying to stimulate in the conventional setting of TENS or IFC. Okay? If we look at conventional TENS or IFC, notice that we use a pulse duration between about 50 and 80 microseconds. Why do we do that? Because in conventional TENS and IFC, we're trying to stimulate these A beta sensory fibers. So the bottom line is when I move this vertical line across here, whatever curves it bisects, those are the nerve fibers or the structures that I am stimulating. Let's now take a look at the acupuncture setting on TENS and IFC. So here's our acupuncture setting. Notice the pulse duration now increases to having to be between about 150 and 300 microseconds. Also remember for the acupuncture setting, okay, we want to see a strong visible muscle twitch. Right? For conventional IFC and TENS, we don't want any muscle twitch. We just want tingling, because all we're doing is looking at the sensory fiber, right? But for acupuncture, we want a strong, visible muscle twitch. So let's now increase our pulse duration to, let's say, about 175 microseconds. So we're kind of right in here. So let me ask you, based on what curves we're bisecting here, what effects might we see? Are we going to have some tingling? Yes, because we are stimulating these A beta sensory fibers. We're crossing that red curve. But now we're also crossing the purple curve, which corresponds to motor neurons. So now we're starting to stimulate some motor neurons, meaning we're going to get some strong visible muscle twitches. Okay? Now, in this curve, the way I've drawn it, we're not yet going to get sharp pain because we haven't yet crossed this green curve. But if we start increasing that pulse duration even more, remember, I can go upwards of 300 microseconds for acupuncture setting on TENS. But even right here at about 250 microseconds, notice now I'm crossing all three of these. Okay? So yes, I'm going to get some tingling because I'm stimulating A beta sensory fibers. I'm going to get muscle contraction, not tetanic contraction, but it is a visible muscle twitch. But I'm also going to start stimulating those A delta nerve fibers, which are going to transmit information on sharp pain. So when you're doing acupuncture setting here, depending on individual differences and the exact part of the body you're doing it on, the size of the muscle, you're going to get multiple things. You have to get the muscle contraction. That's the whole point of the acupuncture. Okay, so you're going to get that. But you may get some sharp pain associated with it, and you may get some tingling. Okay, but the most noticeable things are going to be that muscle contraction and the sharp pain. Remember, the acupuncture setting is a lot more unpleasant than the conventional. Okay, the acupuncture setting you don't do as long, but it provides that analgesic effects afterward. Now, I mentioned that there are individual differences between people. Nobody's the same, right? So if you actually took the time, which nobody does, to construct these curves for two different people, they may look slightly different, right? So let's suppose I'm going to do an acupuncture setting, okay, on a person, and let's do a pulse duration of about 220 microseconds, right? You program a frequency and you crank up the intensity, and you're just doing acupuncture, right? And so we look and see which curves this bisects. Okay, so it bisects the A beta sensory curve, so we're going to get some tingling, right? It bisects the motor curve, so we're going to get stimulation of motor neurons and visible muscle contraction. And I mean, there's a little bit of, crossing the green curve there. So there might be a little bit of sharp pain, but not a lot for this particular patient, right? They're going to be able to tolerate this really well. But let's suppose you do the exact same pulse duration, the exact same frequency, and the exact same intensity on another patient. Did you notice what I did there? Look at the green curve. That's the first one. That's the second one. We've got some pretty significant crossing there on the green curve. So for this patient right here, how might their perception of this treatment differ from the first patient? Again, here was the first patient, here's our second patient. Well, for the second patient, they're probably going to perceive a lot more sharp pain because we're definitely getting some stimulation there of those A delta nerve fibers, right? And they might not like that. And so we want to make sure this is as comfortable as possible for the patient. And if they can't tolerate this, well, there's a couple things that we could do. Okay? The first thing which you generally want to try to do is increase the frequency. Now, of course, frequency is nowhere on this graph. This has nothing to do with frequency, but that's just a fact. A lot of times, patients will actually perceive more comfort if the frequency is higher. So if we're doing acupuncture setting and we had a frequency, let's say, of 2 hertz, well, we could increase it to 5 hertz. You just crank it up and just see if that helps anything. But if the frequency increasing doesn't actually affect the patient's comfort, well, then the obvious solution is drop the pulse duration. And maybe we drop the pulse duration to here. Why might we want to drop it to this point? Well, this is about 198 maybe microseconds, I don't know exactly. But notice, we're still crossing the A beta sensory fibers. We're crossing the motor neuron curve, right? So we're getting visible muscle contraction. But are we getting any more sharp pain? No. So if cranking up the frequency to increase the comfort for the patient doesn't work, you can always crank down the pulse duration, and that can make the patient more comfortable because that will eliminate the stimulation of these A delta nerve fibers. So that's how you go about interpreting the strength duration curve. Okay? You pick an intensity, and then you get this little vertical line right there, or this imaginary vertical line. You can just move it around left or right and see which curves it bisects. And the curves that it bisects are the ones that it is stimulating. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.